Increase in the number of young girls being hospitalized for eating disorders. In Ontario, the cases have more than doubled in just the last 2 years. Philip Lishenik looks at a new study that may explain why.
She works in a hospital now, but just 2 years ago, she was a patient in one, fighting for her life. Down to just 55 pounds, her parents rushed her to the ER.
Before I knew it, I was admitted and kidney failure, I needed dialysis, I couldn't breathe, so I needed to be on a mechanical ventilator, and I spent a long time in the ICU, nearly dying from organ failure.
She now uses her experience in her training to be a nurse.
It definitely shows in the way that I care for people. I've received so many comments that I'm really empathetic.
And she wrote a book about her near-death experience, hoping to help young girls overcome a complex mental illness. And Marina's not alone. Recent health statistics show a disturbing increase in the number of mainly young girls ending up in hospital from an eating disorder. Researchers looked at health data from hospitals across the country and found the rate of young women arriving with life-threatening conditions caused by eating disorders has risen by 42% in the past 2 years. In Ontario, it was even higher, a 55% increase.
There's more openness to going to seek help for mental illnesses, so that is definitely one of the factors.
That makes eating disorders the third most common chronic disease among young women, after asthma and obesity. And there are not enough resources. There are waiting lists for hospital treatments, and programs like this one offering counseling are rare.
Not all eating disorders can be managed in hospital settings, and that's why we try and provide services that reach all stages and all ages in life.
It's the kind of support they need because fighting an eating disorder can be a lifelong battle. Philip Lishenik, CBC News, Toronto.
That's just